Welcome. Today, we're diving into the world of hives, those itchy, rent welts that can suddenly appear on your skin. Hives, also known as urticaria, are a common skin reaction that can be both uncomfortable and concerning. But what actually causes them, and when should you be worried? In this video, we'll explore the triggers behind hives, how your body reacts, and the signs that indicate a more serious problem. Whether you've experienced hives yourself or are just curious, this guide will help you understand what's happening and when to seek help. Hives are raised, red, and often itchy bumps or welts that appear on the skin. They can vary in size and shape, sometimes merging together to form larger patches. Hives can show up anywhere on the body and may last for just a few hours or persist for days. The appearance of hives is usually sudden, and they can disappear just as quickly. While they are generally harmless, their sudden onset can be alarming. Understanding what hives look like is the first step in recognizing and managing them effectively. The most noticeable symptom of hives is the appearance of red or skin-colored welts that are often itchy. These welts can change shape, move around, and sometimes even disappear and reappear in different places. Some people may also experience swelling, especially around the eyes, lips, hands, or feet. The itching can range from mild to severe, and scratching may make the irritation worse. Recognizing these symptoms can help you identify hives early and take steps to relieve discomfort. Hives form when your body releases histamine and other chemicals into the skin. This release causes blood vessels to leak fluid, leading to swelling, and the characteristic red welts. The process is usually triggered by your immune system reacting to something it sees as a threat, even if it's harmless. This immune response is what leads to the rapid appearance of hives, often within minutes of exposure to a trigger. One of the most common causes of hives is an allergic reaction. When your body encounters an allergen, like certain foods, medications, or insect stings, it can trigger the immune system to release histamine. This leads to the rapid development of hives. Allergic hives often appear within minutes to an hour after exposure and may be accompanied by other symptoms, such as swelling or difficulty breathing. Recognizing the link between allergens and hives is crucial for prevention and treatment. Certain foods are well known for causing hives, especially in people with allergies. Common culprits include nuts, shellfish, eggs, milk, and some fruits. When you eat a food you're allergic to, your immune system reacts quickly, often resulting in hives. Sometimes, even trace amounts of an allergen can cause a reaction. If you notice hives after eating specific foods, it's important to identify and avoid those triggers to prevent future outbreaks. Medications are another frequent cause of hives. Antibiotics, pain relievers like aspirin or ibuprofen, and even some blood pressure medications can trigger an allergic response. Hives may appear shortly after taking a new medication, or even after repeated use. If you suspect a medication is causing your hives, contact your healthcare provider immediately. Never stop a prescribed medication without consulting your doctor first. Insect stings and bites can also cause hives, especially in people who are allergic to the venom. Bees, wasps, and ants are common offenders. The reaction can be localized, with hives appearing around the sting, or more widespread across the body. Severe allergic reactions to stings can be life-threatening and require immediate medical attention. Always monitor for additional symptoms like swelling of the face or difficulty breathing. Sometimes, hives are triggered by environmental factors rather than allergens. Common triggers include pollen, pet dander, dust mites, and mold. These substances can irritate the skin or respiratory system, leading to hives in sensitive individuals. Environmental hives may be seasonal or occur year-round, depending on exposure. Reducing contact with known triggers can help minimize outbreaks. Physical factors can also cause hives in some people. These include pressure on the skin, scratching, exposure to heat or cold, sunlight, or even exercise. For example, wearing tight clothing or carrying a heavy bag can lead to pressure-induced hives. Similarly, sudden temperature changes or sweating during exercise may trigger a reaction. Understanding these physical triggers can help you avoid situations that provoke hives. Believe it or not, emotional stress can also trigger hives. When you're anxious, nervous, or under pressure, your body releases stress hormones that can affect your immune system. This may lead to the development of hives, especially if you're already prone to skin reactions. Managing stress through relaxation techniques, exercise, or talking to someone can help reduce the frequency of stress-induced hives. Viral and bacterial infections can sometimes cause hives, especially in children. Common illnesses like the common cold, strep throat, or even urinary tract infections may be accompanied by hives. The body's immune response to fighting off the infection can inadvertently trigger the release of histamine, leading to skin reactions. If hives appear during an illness, it's important to monitor for other symptoms and consult a healthcare provider if needed. Hives can be classified as acute or chronic. Acute hives last less than 6 weeks and are usually linked to a specific trigger, like an allergy or infection. Chronic hives, on the other hand, persist for more than 6 weeks and may not have an obvious cause. Chronic hives can be frustrating and may require ongoing management. Understanding the difference helps guide treatment and expectations. Sometimes, hives appear without any identifiable cause. These are called idiopathic hives. In many cases, the immune system reacts for reasons that aren't fully understood. Idiopathic hives can be acute or chronic and may come and go unpredictably. If you experience frequent, unexplained hives, your doctor may run tests to rule out underlying conditions, but often no specific cause is found. In some cases, hives are linked to autoimmune conditions, where the immune system mistakenly attacks the body's own tissues. Conditions like lupus or thyroid disease can be associated with chronic hives. Autoimmune hives may be more persistent and harder to treat, often requiring specialized care. If you have a known autoimmune disorder and develop hives, let your doctor know. Most cases of hives are mild and resolve on their own, without treatment. However, hives can sometimes signal a more serious underlying issue, especially if they're accompanied by other symptoms. It's important to know when hives are just a nuisance and when they require urgent medical attention. In the next scenes, we'll discuss warning signs and when to seek help. The most serious risk associated with hives is anaphylaxis, a severe allergic reaction that can be life-threatening. Signs of anaphylaxis include difficulty breathing, swelling of the face or throat, rapid heartbeat, dizziness, or loss of consciousness. If you or someone else experiences these symptoms along with hives, call emergency services immediately. Quick action can save lives. Besides anaphylaxis, there are other symptoms that may indicate a serious problem. These include persistent vomiting, severe abdominal pain, confusion, or a high fever. If hives are accompanied by any of these symptoms, seek medical attention right away. These signs could point to a more severe allergic reaction or an underlying illness that needs prompt evaluation. If your hives last more than a few days, keep coming back, or are very uncomfortable, it's a good idea to see a healthcare provider. You should also seek help if you can't identify a cause, if hives interfere with your daily life, or if you have other health conditions. Your doctor can help determine the cause and recommend appropriate treatment. Diagnosing hives usually starts with a physical exam and a review of your medical history. Your doctor may ask about recent exposures, new foods, medications, or stressful events. In some cases, allergy testing or blood tests may be recommended to identify triggers or rule out underlying conditions. Keeping a diary of your symptoms can be helpful during the diagnostic process. Most cases of hives can be managed at home with simple treatments. The main goal is to relieve itching and discomfort while avoiding triggers. Over-the-counter antihistamines are often effective in reducing symptoms. In more severe cases, prescription medications or other therapies may be needed. Your doctor will tailor treatment to your specific situation. Antihistamines are the first-line treatment for hives. These medications block the effects of histamine, reducing itching and swelling. Common over-the-counter options include cetirizine, loratadine, and diphenhydramine. Always follow the dosing instructions and consult your doctor if you have questions or if symptoms persist. Identifying and avoiding triggers is key to preventing hives. This may mean reading food labels carefully, avoiding certain medications, or minimizing exposure to environmental allergens. For physical triggers, wearing loose clothing and avoiding extreme temperatures can help. Keeping a symptom diary can make it easier to spot patterns and avoid future outbreaks. Several home remedies can help soothe hives. Applying a cool compress to the affected area can reduce itching and swelling. Taking a cool bath with baking soda or oatmeal may also provide relief. Wearing loose, comfortable clothing and avoiding hot showers can prevent further irritation. Remember, if symptoms worsen or don't improve, seek medical advice. In some cases, your doctor may prescribe corticosteroids to reduce severe inflammation. Steroids are usually reserved for short-term use in cases where antihistamines aren't effective. They can quickly reduce swelling and itching, but are not suitable for long-term management due to potential side effects. Always use steroids as directed by your healthcare provider. For chronic or severe hives that don't respond to standard treatments, your doctor may recommend other medications. These can include immune-modulating drugs or biologics that target specific pathways in the immune system. Such treatments are typically reserved for persistent cases and require close monitoring by a specialist. Making simple lifestyle changes can help reduce the frequency and severity of hives. This might include managing stress, maintaining a healthy diet, staying hydrated, and getting enough sleep. Regular exercise and relaxation techniques, such as meditation or yoga, can also support your immune system and overall well-being. Hives are common in children and often result from viral infections, food allergies, or medications. Most cases are mild and resolve quickly, but parents should watch for signs of a severe reaction, such as difficulty breathing or swelling of the face. If these symptoms occur, seek emergency care immediately. Otherwise, home care and antihistamines are usually sufficient. Pregnant women can also experience hives, sometimes due to hormonal changes or increased sensitivity to allergens. Most cases are mild, but it's important to consult your healthcare provider before taking any medication. If hives are severe or accompanied by other symptoms, seek medical advice promptly to ensure the safety of both mother and baby. Older adults may be more susceptible to hives due to changes in the immune system or increased medication use. Chronic hives can be particularly bothersome in this group. It's important for elderly individuals to consult their healthcare provider for proper diagnosis and management, especially if hives are persistent or severe. While most hives are harmless, complications can occur. These include skin infections from excessive scratching, sleep disturbances due to itching, and emotional distress. In rare cases, chronic hives may be linked to underlying health conditions. Addressing complications early can help prevent further problems and improve quality of life. Preventing hives starts with knowing your triggers and taking steps to avoid them. This may include allergy-proofing your home, using gentle skincare products, and avoiding known allergens. Regular hand washing and keeping your environment clean can also reduce the risk of infections that might trigger hives. Prevention is always better than cure. Living with chronic hives can be challenging, but there are ways to manage symptoms and maintain a good quality of life. Working closely with your healthcare provider, following treatment plans, and making lifestyle adjustments can help. Support groups and counseling may also be beneficial for coping with the emotional impact of chronic hives. There are many myths about hives, such as the idea that they're always caused by allergies or that they're contagious. In reality, hives have many possible triggers, and they cannot be spread from person to person. Understanding the facts can help reduce anxiety and prevent unnecessary worry. Proper skincare can help prevent irritation and reduce the risk of hives. Use mild, fragrance-free soaps and moisturizers, and avoid harsh chemicals or hot water. Gently pat your skin dry after bathing, and wear loose, breathable clothing. Taking care of your skin can make a big difference in managing hives. Keeping a detailed record of your hives, including when they appear, what you ate, medications taken, and activities, can help identify patterns and triggers. This information is valuable for your doctor and can lead to more effective management. Use a notebook or a smartphone app to track your symptoms over time. If you experience recurring hives, it's important to work with your healthcare provider to identify possible triggers and develop a long-term management plan. Sometimes, more extensive testing or specialist referral is needed. Don't ignore persistent or recurring hives, as they may signal an underlying health issue. Chronic hives can impact your quality of life by causing discomfort, sleep disturbances, and emotional stress. It's important to address both the physical and emotional aspects of living with hives. Support from family, friends, and healthcare professionals can make a significant difference in coping and recovery. There are many resources available for people living with hives, including patient support groups, online forums, and educational materials. Connecting with others who have similar experiences can provide comfort and practical advice. Don't hesitate to reach out for help if you're struggling to manage your symptoms. Research into hives and their causes is ongoing, with new treatments being developed all the time. Advances in immunology and biotechnology are leading to more targeted therapies for chronic and severe cases. Staying informed about new developments can help you and your doctor make the best decisions for your care. To recap, hives can be caused by a wide range of factors, including allergies, medications, infections, physical triggers, stress, and sometimes unknown reasons. Understanding your personal triggers and working with your healthcare provider is key to effective management. Remember, most cases are mild, but it's important to recognize when hives are a sign of something more serious. Hives are common and usually harmless, but they can sometimes indicate a serious allergic reaction. Knowing the causes, recognizing warning signs, and understanding when to seek help are essential. Most people can manage hives with simple treatments and lifestyle adjustments, but don't hesitate to consult a healthcare provider if you have concerns. Living with hives can be frustrating, but understanding the causes and knowing when to seek help can make a big difference. stay informed, take care of your skin, and work with your healthcare provider to find the best management plan for you. Remember, you're not alone. Support and effective treatments are available. If you need more information or support, reach out to your healthcare provider or look for reputable online resources. Patient advocacy groups and medical organizations often provide helpful guides and support networks. Don't hesitate to seek help if you're struggling with hives or have questions about your health. Thank you for joining us as we explored the causes of hives and when they become serious. We hope this video has helped you better understand this common skin condition and how to manage it. Stay healthy, stay informed, and remember, help is always available if you need it.